Welcome, everyone. My name is Megan Clark, Chief Operating and Financial Officer of Whitaker Center. Thank you for coming today. We are excited to welcome the Department of Human Services Acting Secretary Meg Snead and Acting Physician General Dr. Denise Johnson to Whitaker Center to talk about how children can be safe who are not yet eligible to receive the COVID-19 vaccine. Here at Whitaker Center, we are encouraging families and parents to wear a mask when they come visit. We're welcoming all families here. We think it's really important for families and children to get back out in the public, interacting with others, their peers, and just collaborating as a group. And our summer camps that we're offering this summer have been filled to capacity, which we are very excited about. When campers come here in the morning, their parents drop them off. We do encourage them, to wear their mask inside the building as they're coming in. And we're hopeful that the parents, when they drop them off, reiterate that to their children. As I mentioned, we found it really important to have our summer camps this year. They're typically very popular for kids. It's really important that kids get back out there in the public, return to socially interacting with other peers, collaborating, and really learning about arts and science and STEM to help them when they return to school for their school year. Safety here is definitely our utmost importance. We take safety of our guests and the children very seriously. And when we came back and opened again this past March, after being closed for 12 months, we increased our cleaning. We do cleaning in the morning, cleaning in the afternoon, and then we do regular cleaning throughout the day of our exhibits as they, everything you see here at the Whitaker Center is high touch, and we have a lot of shared objects. So we've increased cleaning regimens throughout the day to keep the children safe while they're here. At this time, I am pleased to turn it over to the Acting Secretary of DHS, Meg Snead.
Thanks so much, Megan, and for hosting us today at the Whitaker Center, and thank you all for joining us. My name is Meg Snead, and I have the honor of serving as the Acting Secretary for the Department of Human Services. We're grateful to be partnering with the Whitaker Center today and for all the work they've done during the last year to keep the families who visit their museum safe. The Wolf administration remains committed to helping parents keep their families safe as we reopen and more normal activities resume. As adults and older children continue to get vaccinated, many parents have questions about what activities are safe for them to do with their children. So today we want to provide some guidance and advice to families so they can enjoy the summer activities as safely and confidently as they can. And while the statewide mask mandate has been lifted, it's important that we continue to take steps to keep ourselves, our children, our families, and friends safe. The FDA currently authorizes the use of the Pfizer vaccine for individuals 12 years or older. That means that at the moment, children under the age of 12 are not yet eligible for the COVID-19 vaccine, and at this time, we don't know when that vaccine will be available to these younger kids. As such, there's still a risk of COVID-19 spread among children, and please note that children, regardless of age, with underlying medical conditions may also be at increased risk of severe illness from COVID-19 compared to other kids. As a mom to 2 young girls, I want my girls to have an enjoyable summer, but I know and understand that although life is starting to get back to normal, COVID-19 is still spreading. So I want them to have fun, but I also need them to be safe. DHS and our Office of Child Development and Early Learning, or OCDEL, want to reiterate guidance from the Center for Disease Control and Prevention, or the CDC, and the Pennsylvania Department of Health. The CDC recommends that children under the age of 2 do not wear face coverings. Although masks are no longer required outside of healthcare settings, we should all feel empowered and comfortable continuing to wear them in spaces where there could be a higher risk of transmission, especially while our younger kids cannot yet get vaccinated. Children between the ages of 2 and 12 who cannot yet get vaccinated, however, can continue to wear a face covering in public settings, at events and gatherings, and anywhere they'll be around people outside of their household. If a child is unable to wear a face covering or get vaccinated, the CDC recommends more low-risk activities, such as enjoying activities outdoors with members of your household or attending a small outdoor gathering with fully vaccinated friends and family. Risk of COVID-19 infection increases if unvaccinated children come from multiple households. So in situations like this, the safest place to visit is outdoors. Indoor activities can occur, and all people involved are encouraged to take safety precautions, including wearing a face covering that fits snugly, staying distanced from others as we can, and visiting in a well-ventilated space. This includes visiting with fully vaccinated grandparents without wearing face coverings or physical distancing, provided none of the unvaccinated family members are at risk of severe COVID-19. All of this guidance, regardless of a child's age or vaccination status, should be applied alongside with washing your hands with soap and water for 20 seconds, making sure your child and everyone else in your household keeps safely distanced from other people who don't live with them and people who are sick, and making sure your child covers their mouth and nose with a tissue when coughing or sneezing. Staying home if you're unvaccinated and sick with or tested positive for COVID-19, or were recently within the last 14 days exposed to COVID-19, and any person, regardless of vaccination status, experiencing new or unexplained symptoms of COVID-19 still needs to isolate and be evaluated for COVID-19. And please continue routine doctor appointments and vaccine visits. As summer continues and Pennsylvanians are getting vaccinated, we are all hoping to return to some semblance of normalcy. But this pandemic is not through yet. So I urge everyone to follow this guidance and continue working together to prevent further spread of COVID-19 between children and families so we can celebrate summer safely. And if you or your older children have not yet gotten your COVID-19 vaccine, please do so as soon as possible. These vaccines are our most effective resource in our fight against this pandemic. We continue to make progress, but that is only going to happen if we're all doing our part by getting vaccinated. Thank you again to the Whitaker Center for having us today, and I'll turn things over to Acting Physician General Dr. Denise Johnson.
Good afternoon, everyone. I'm Acting Physician General Denise Johnson, and I'm excited to be here at the Whitaker Center and to join Secretary Snead to talk about summer and getting our kids out and enjoying the summer. So right now we are in a very different place than we were a year ago, and families and kids are starting to get out and enjoy the summertime. And we want that to happen, but we want it to happen safely. As you know, the pandemic is not over. We are still having cases, we're still having hospitalizations, and unfortunately, we're still having deaths. But there's a bright spot because there's something that we can do. Right now, anyone 12 years and older is eligible to be vaccinated. We've got 3 very safe and effective vaccines that are keeping people from getting severely ill or dying with COVID. They have been given to millions of people, and we've seen that the infection rates have really gone down with these vaccines, and so we want to encourage everyone to be vaccinated. The vaccines make your body produce an immune response that protect you against severe disease and hospitalization without having to get the illness. And vaccines are freely available and are free to everyone. We want to encourage those of you who have already been vaccinated to reach out and let your family and friends know about your experience and why you were vaccinated. We need you to spread the word and be able to tell people about that vaccination experience. If you've not been vaccinated, maybe you need to know where a vaccination center is. You can text GetVax or Vacuna for Spanish and find the 3 locations nearest to you that are giving vaccines. If you need more information, our website at pa.gov/COVID has a lot of information there, or reach out to your healthcare provider to get your questions answered. We want everyone to have the information that they need to make the good decision to get vaccinated. As you heard from Secretary Snead, kids under 12 years old are not yet eligible to be vaccinated. And so to protect them and give them the freedom to do things this summer and beyond, we need all of us to get vaccinated to protect them and to protect ourselves. So if you need any information, our website has it. See your healthcare provider, but want you to get vaccinated. And one last note, if you've had one dose of a 2-dose vaccine, you need to get that second dose. From the Delta variant, we have learned that getting just partial doses is not giving you the full protection. So even if you're late for that second dose, there's no recommendation to start over. You just need to get that second dose. So really want everyone to get fully vaccinated to protect ourselves, our community, and our kids so that we could get out and have fun this summer. Thank you very much.
Thank you all for coming. We appreciate you being here. We can take any questions if anyone has any.
I know this event's focused on summer, but we got schools coming up in about a few weeks now. CDC is recommending masks pretty much universally for, I guess, kids who are not vaccinated, people who aren't vaccinated. AAP went a little bit further than that. Can you talk about why the state is not requiring that schools do this? I know a lot of people have questions about that because you guys recommended that people follow the CDC, but we've got school districts that are already saying we're not requiring masks at all, don't worry.
Sure. So we certainly are recommending following the CDC guidance. We believe that kids should be back in school. That's the best thing for them. They have missed all that socialization as well as education. And so to get kids back at school safely, we've had lots of experience that has shown that if we're taking the precautions, meaning the hand washing that Secretary Snead talked about, masking as part of it as well, then we could decrease the transmission in schools and have kids there safely. So we are recommending following the CDC guidance, and we're working with with our schools to make sure that they have all the resources that they need to implement those measures.
Would you advise parents with children who are under the age of 12 to wear masks? I mean, I talked to some doctors who said a lot of the cases in kids actually come from interaction with their parents. So what should parents be doing with kids who are under 12 who can't get the vaccine?
So those parents should be vaccinated, and so that in households where parents are vaccinated, everyone who is eligible to be vaccinated, those chances of the kids to be infected are much, much diminished, unless the kids are going to be interacting with unvaccinated people. So, again, all of us who are eligible to be vaccinated, we're the ones who could protect the kids.
And even if they are vaccinated, would you advise the parents to continue wearing masks?
If you're in your household and all of the people who are eligible are vaccinated, the chances of contracting COVID or spreading it are much, much diminished. I know that there are breakthrough cases, but those are a small number. And even in the breakthrough cases, those viral loads tend to be quite a bit lower. So if your household is vaccinated and you have kids and they're not interacting with unvaccinated, the risk for your kids should be very low.
Parents go out in public, go to the grocery store.
So again, fully vaccinated, as we know, the risk for infection is really quite low if you're fully vaccinated. If you are in crowded spaces with people who are unvaccinated, some people will choose to wear a mask, and that certainly is reasonable.
The recommendation as opposed to the order. So right at this point now, the Department of Health is not saying to schools, unvaccinated children must wear masks. And the other question I have related to school buses. The CDC recommends it on public transportation and paid school buses that kids wear masks. Is that a requirement? Is that a recommendation? Is that just a suggestion?
So right now, the recommendations for public transportation is to wear masks. That hasn't changed, and I don't anticipate it changing for school buses as well. The Department of Health at this point has not made a mandate, but certainly we recommend, and we're going to work with schools and any other groups to help them again to implement those recommendations.
There's been a lot of questions about testing that I've seen come up. I know the state has set aside a lot of money to try and assist with that with schools.
Yes.
Is testing going to be mandatory in any cases, or is it just for people who might be wondering this? I mean, you might have an answer to that.
So I don't have, and we could follow up with you on what's going on in terms of school testing, but I know that testing for schools has been offered by the state and by the federal government, and so school districts have an option to avail themselves of either strategy, but we can certainly follow up with you.
If you look at the data, most of the hospitalizations, the deaths are those who are unvaccinated. So it does show that unvaccinated people are continuing to drag this virus. What's your message to them? Because, they're the ones putting the, kids and the people who can't get the vaccine, at risk. So what's your message to them? Because, there's nothing kids can really do right now.
Sure.
Taking the vaccine.
So again, our message is if people have not been vaccinated and they have questions, to find a trusted source of information. So that may be your family doctor, or it may be information on our website to get your questions answered. Because we believe that there are people who have questions, legitimate questions that they want answered before they make that decision to be vaccinated. So we are reaching out to make sure that those questions can get answered so that people can get vaccinated.
What's your message to those people who, it might not just be a lack of information that they need. There are some people who are pretty, set against not getting the vaccine.
Sure. So getting a vaccine is an individual decision, and so that, if someone, for whatever their reason, decides not to get that vaccination, certainly they have the ability to make that decision. But we would hope that people understand that we have vulnerable people among us, especially kids, and we have great tools to protect those kids, tools that we know are safe and that work, and so that we will, continue to encourage them to take advantage of that tool.
I forget where I saw it, but I think it's believed that Delta is representing something like 5% of cases in Pennsylvania. That's just what one database showed. Do you think it's a bigger problem than what we might be seeing right now as far as the numbers? Because I know just a couple of weeks ago it was like 1%. Do you think it's a bigger problem since there's that statistical lag?
Well, I think that, we're certainly not sequencing every single case. So, that number is just of what we've sequenced. The other thing is that we know from this pandemic that what happens on the other side of the world is going to happen here. So out west, where they've had high percentage, I think a week or two ago they were at 80%. Now we know that the nation is at 80%. So there's no reason to believe that Pennsylvania will be any different. Our Delta proportions are certainly going to go up.
Any update on, when we can expect more children to be eligible for the Pfizer vaccine?
No, we certainly know that the vaccine makers that have vaccines here right now, so Pfizer, Moderna, and J&J have been doing dosing studies in younger kids. We don't have any firm timeline on when that will be. I think there's some speculation that, maybe by the end of the year, maybe in the beginning of the year, but we don't have any firm timeline on that. I'm sorry, I can't hear you.
I'm sorry. With schools putting their health and safety plans together now, is there a source that you think should take precedence? Because that's what I'm hearing from schools, is that there's so much conflicting information, like the American Academy of Pediatrics, the CDC. Sometimes St. Luke's, they say how these things all get conflicting, and then they don't know who to follow.
Sure, yeah. So again, the state is recommending the guidance from the CDC, although we certainly understand the American Academy of Pediatrics, really wanting to make sure that they go that extra step to make sure that kids are safe. So, you know, schools are always welcome to have stricter guidance than the CDC, but we believe that they should at least follow the guidance of the CDC.
You guys schools should consider vaccination mandates or stay out?
I'm sorry? Well, right now we have not been recommending a mandate. What we've been recommending is that staff be provided adequate access to get vaccines very quickly and easily, and that they be provided the information that they need to be able to make the decision to be vaccinated. Okay?
I know you talk a lot about what you're recommending for stuff during the summer. Do you think that, I mean, a lot of this stuff sounds like what's kind of being recommended for the school settings. Do you think that that's something that could rub off on kids over the summer and potentially lead to a safe school year?
Yeah, I think taking the same precautions with kids that aren't able to get vaccinated yet is going to be important as we start the school year. So for kids that, I guess I would say this, families should feel empowered to wear masks when they're inside. If there's questions about the people that you're surrounded by and whether or not they may be vaccinated, I think erring on the side of caution and having kids wear a mask is a good thing. Anybody else? All right. Thank you very much, everybody. That means that at the moment, children under the age of 12 are not yet eligible for the COVID-19 vaccine. And at this time, we don't know when that. Today, we want to provide some guidance and advice to families so they can enjoy the summer activities as safely and confidently as they can. And while the statewide so I want them to have fun, but I also need them to be safe. DHS and our Office of Child Development and Early Learning, or OCDEL, want to reiterate guidance against this pandemic. We continue to make progress, but that is only going to happen if we're all doing our part by getting vaccinated. Thank you again to the Whitaker Center. New or unexplained symptoms of COVID-19 still needs to isolate and be evaluated for COVID-19. And please continue routine doctor appointments and vaccine visits. As occur, and all people involved are encouraged to take safety precautions, including wearing a face covering that fits snugly, staying distant from others as we can, and visiting in a well-ventilated severe COVID-19. All of this guidance, regardless of a child's age or vaccination status, should be applied alongside.
Good afternoon, everyone. I'm Acting Physician General Denise Johnson, and excited to be here at the Whitaker Center. We want that to happen, but we want it to happen safely. As you know, the pandemic is not over. We are still having cases. We're still having hospitalizations. We believe that kids should be back in school. That's the best thing for them. They have missed all that socialization as well as education. And so to get kids back at school safely.
Your recommendation as opposed to an order. So right at this point now, the Department of Health is not saying to schools, unvaccinated